Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, amid the threat of the Delta variant, the health department says the Philippines is now back at high risk for COVID-19. Malacanang hopes this could be the last ECQ for the country, but the Vice President says more testing and vaccinations are needed to make that happen. And after rejecting Senator Ping Lacson's Unification plan, what are her options for the 2022 elections? Vice President Leni Robredo joins us live. The health department says that the country is now back to high-risk classification due to rising COVID-19 cases. Amid the threat of the Delta variant, more hospitals are also dealing with increasing COVID-19 patients. At least 25 hospitals in Metro Manila are now under critical level. So how should the government maximize the 2-week ECQ, and will this be enough against the Delta variant? Let's go straight to the source of the story. We have Vice President Leni Robredo. Vice President Robredo, thank you for your time and welcome back to the source.
Hi, Pinky. Good morning. It's nice to see you again. Thank you for having me.
Good to see you. Vice President, let's just look at the situation we're in right now. 8,900 cases recorded yesterday. The DOH says that that was even a low turnout due to lab outputs. The Philippines now categorized as high risk. The Delta now present in 13 regions in the country. With the situation that we are in right now, would you say this was the inevitable, knowing that Delta has actually affected many other countries in the world?
Very much, Pinky. For several months now, if you recall, experts and health professionals have been warning us about the threat of the Delta variant. Yung mga kwento naririnig natin about India, Indonesia, Malaysia, and even Thailand. And they were even performing much, much better before. Really show that the Delta variant, yung potent danger of the Delta variant, and the danger that we will have another surge because of that. And ngayon, ramdam na namin yun, Pinky, with the dramatic rise in our numbers, again, with Bayanihan e-Consulta. Our numbers yesterday was 8,900 all over the country, and 21% yung positivity rate. So gusto sabihin talagang the surge is real. Sa amin, sa Bayanihan e-Consulta, June-July levels, we were receiving less than 100 new cases a day. Yesterday, we had, I think, 402. So kahit sa amin, from our end, ramdam na.
So for you, it is an obvious surge.
Yes. Ano talaga, Pinky, if you look at the numbers, the rise of the number of new cases in the entire country has been dramatic. Kasi di ba, nandun tayo sa mga 4,000 levels just a few weeks ago. And I think the other day, we were at 11,000. Kahapon was 8,900, but DOH was reporting that parang it's Tuesdays and Wednesdays are naturally, Mondays yata and Tuesdays, or Tuesdays and Wednesdays are naturally parang low numbers for us because of the weekend.
That's right. How is government doing so far now with its COVID response?
Ako, Pinky, I did a parang I uploaded a video message with recommendations last August 4, but I've been reading about the Delta variant, and we really need to recalibrate all our efforts now because Delta variant is a game changer. There are a lot of things na mas delikado tayo compared to the previous surges. Halimbawa, ang sinasabi ng epidemiologists, yung transmission rate of COVID-19 without the variants was just at 2 to 3. yung Delta variant is 6 to 9. Gusto kong sabihin, ganun kabilis yung magiging transmission. So before Pinky, kahit nung August 4, nagsabi ako ng mga numero like we should be testing more, we should be vaccinating 750,000 a day already. Pero with the new information about the Delta variant, mukhang yung dati nating recommendations hindi na pwede. So there's really a need to recalibrate. Pag tiningnan natin yung mga ginagawa ng ibang bansa, it is very, very important to keep on measuring effective reproductive number and not just the basic reproductive number. And pag tiningnan mo, Pinky, importante yung number of people being vaccinated, importante yung efficacy of the vaccines being deployed. Ano talaga siya? It's many different things. Halimbawa, one of my recommendations was to increase testing at na 120,000 a day. I was telling you earlier na 21% yung positivity rate natin kahapon at 8,900 cases. Pero when you look at how many tests were conducted, nandun pa din tayo sa dati nating level before, which is in the range of 50,000 pesos. Ay, 50,000 tests, I mean. 50,000 tests. So gusto sabihin, we should really test more kasi the international standard is positivity rate should be less than 5. So if it's 21% yesterday, we conducted 50,000 tests. Yun yung denominator natin pagkwenta ng positivity rate. Gusto sabihin, hindi tayo nagte-test enough. And this is something we have repeatedly recommended since last year, that we should test more para yung positivity rate natin mas mababa. We should test more para mas makita natin kung yung transmission nasaan. Bakit mahalaga na makita natin yung transmission? Para ma-isolate kaagad natin. Para ma-isolate natin yung mga cases. Because the worst thing that can happen to us is there are cases na gumagala na undetected. Kasi lalong gagrabe yung transmission pag ganon. And we all know that yung COVID, marami yung asymptomatic, marami yung mga mild cases. So yung sa akin, yung number one recommendation really is to increase testing. The second recommendation, again, I kept repeating this already since last year, is really to streamline and strengthen our contact tracing efforts. Kasi di ba, Pinky, more than a year into the pandemic, parang labo-labo pa din. Ang daming mga apps, which means pag maraming apps, gusto sabihin, ang dami din na database. Para sa akin, dapat isa lang. Government has already mandated Stay Safe as the contact tracing app we should all use. Pero dahil very late na ito minandate, nagkanya-kanya na yung mga LGU. And there is not enough effort to streamline all the existing ones to have just one database. And for me, that's very, very important. Even if we are so many contact tracers, if we don't streamline everything, mahihirapan tayo. Kasi ano naman mobile ang tao, hindi naman natin nako-contain yung tao sa isang geographic na unit. Yung mobility contributes to transmission. So sa akin, pag ang contact tracing app, masyadong masyadong parochial sa mga lugar, walang effort to streamline everything. Kahit ang dami nating i-hire, mahihirapan tayo.
Knowing that what you said earlier, that obviously you've also been studying the Delta variant, and we have been informing the public about this, for example, the transmissibility from 2 to 3, now we're looking at 6 to 8 or 6 to 9. A positivity rate should be, World Health says 5%. We're now looking at 20%. I want to go back to my earlier question, Vice President. I hope you don't mind. Knowing that we knew this, and knowing obviously that government was very much aware of this, did government prepare enough for this Delta variant and for what is happening right now?
Ako, Pia, government exerted a lot of effort. But with COVID-19, it's really never enough. Kahit saang lugar, it's never enough. It's evolving . Kahit yung variants, diba? Tuloy-tuloy yung paglabas. Gaya ngayon, meron naman sinasabing lambda. So talagang kailangan bilisan. Halimbawa, halimbawa with vaccination, I read yesterday that we're doing something like 500,000 jobs a day already in the country, and that's big. Several months ago, it's parang very welcome na nakarating tayo sa ganitong numbers a day. But with Delta variant, it's not enough anymore. 'Di ba? Kaya sinasabi ko na it's evolving because the variants are also evolving, and the information that we're getting increases by the day. So dapat
Okay.
talaga masyado tayong nimble and agile para hinahabol natin yon. Kaya
Doon po,
ang naalala ko, Pinky, I was saying,
yeah. Sige po, Vice President, please go ahead.
I was saying, Pinky, if you recall, in my August 4 message, I was saying that dapat ini-aim na natin yung 750,000 a day jobs. Pero no, parang hindi na din siya enough. We should aim more. We should aim for a higher number. Dapat nagmi-milyon na tayo a day if only masabayan natin or maunahan natin yung pagkalat ng Delta variant. Yun yung sinasabi ko, Pinky, na the infrastructure has to be there already para as the information comes, mas nagiging madali for us na mag-adjust ng ating mga ginagawa.
Understandable. So we need to evolve. We need to siguro keep up with the times. Ano po. So doon sa ilang recommendation nyo, 5 po yun. Yung sinasabi nyo 120,000 testing, obviously that has not happened, Vice President. We are at 50,000. Yung pong unifying contact tracing, hindi pa rin po sa atin lahat si stay safe. Yung pangatlo pong sinabi nyo, yung 750,000 vaccinations per day. Now you're saying this has to increase to 1 million. I did read a reply by Secretary Vince Dizon at sinabi po niya that their target right now is 1 million. Although I did see also that the record high vaccination a couple of days ago, umabot po ng 700. Pero ano ho yan taas baba din po yung numero on vaccination. Very important. I hope you don't mind. Number 4, be hospital ready. I need to discuss this with you because this is your recommendation. We need to be hospital ready. Vice President, ang PGH, ang St. Luke's, NKTI, Quezon City General Hospital, if I'm not mistaken, and other hospitals are saying they are already full. What did we not do right, or what did we not prepare enough to be hospital ready?
I don't think so, Pinky. There are a lot of factors that can make us say that we are already hospital ready. Halimbawa, sinasabi na for a 32-bed ICU, intensive care unit, it would cost us approximately, parang roughly around 40 million pesos to build. Parati tayong kinukulang sa ICU. Kahit may beds pa sa ospital, yung ICU laging punuan ngayon, even in the provinces. So para sa akin, if we aim to build 1,000 more ICU beds, it would cost the government about 1.3 billion pesos. Dapat noon pa, and ginawa naman ito, Pinky, pero not enough. Dapat noon pa, when the threat of COVID-19 was coming to our shores, we should have started building ICU units already or increase bed capacity of ICU units already. Ang sinasabi ng experts, Pinky, to build a 32-bed ICU will take about a month. So sa akin, ang daming mga period since last year that we could have taken advantage of. As I have said, hindi natin sinasabi na walang effort to do that. Pero ano ba, realigning budget priorities. Are we allocating enough? Are we allocating enough para capacitate us to build 1,000 more ICU beds? I don't think so. Medical personnel. It is also important to beef up on medical personnel and supplies. Parati natin sinasabi, recruit more nurses, have the needed medicines and equipment ready. Pero sa marami nating mga ospital, hindi pa nga nababayaran ng PhilHealth. 'Di ba? Pag nabayaran lang sana sila ng maayos ng PhilHealth, they would be in a capacity to improve what they have already. Yung pangalawa, yung the state of our underpaid healthcare workers. Ayan, sabi ko nga kanina, lagi natin sinasabi, recruit more nurses, but we are having a hard time recruiting. Bakit ganun? Until now, marami nagrereklamo. We haven't released the hazard pay for all medical frontliners yet. Are we making their pay in the country at par with our neighboring countries para hindi na sila labas ng labas? Halimbawa, magkano ba yung sweldo? Magkano ba yung sweldo ng nurse entry level salary? I heard it's 33,000 for nurses in the country. Mababa yun. If you compare that to our neighbors, ang Vietnam, it's 63,000. Indonesia, it's 79,000. Yung Malaysia, it's 97,000. Yung Singapore nga, Pinky, 236,000. So if we're offering 33,000 entry-level salary, paano natin ma-hold yung ating mga nurses from working abroad? Ito mariresolve ito pag inayos natin yung budget allocations. Yung paniniwala ko, Pinky, let us always err on the side of generosity. It is only fair that our health workers are compensated for their heroic sacrifices. More than one year na sila, Pinky. More than one year na sila na halos walang pahinga.
Vice President Leni Robredo, we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Vice President Leni Robredo. I wanted to quickly ask you about the ECQ, Vice President. Do you think that the implementation last August 6th was the right time? Was it too early or was it too late?
Ako, Pinky, dapat kasi tingnan natin yung ECQ as just a stopgap measure. It's not the end all. You can't really say that the declaration of the ECQ will solve everything because it would depend on what you do during the ECQ. It's meant to not just to limit the transmissions, but it's also meant to give our hospitals and our medical infrastructure a breathing space para makahabol sila. So sa atin, masasabi natin we were able to make good use of the ECQ. Depende kung ano yung ginagawa natin ngayon. So it can't be what happened last year na sobrang tagal ng ating ECQ kasi we saw in the dips in our GDP how economically costly our ECQs were. So depende talaga, Pinky, what we do during this period now.
Okay, but so far, how are we doing during this ECQ? Would you say you're satisfied so far by what has been implemented since August 6th?
It's difficult to say that we're satisfied or not. We appreciate all the efforts, not just of all the government agencies, but even the private sector who's been helping out. I've been reading about the initiatives of the private sector in helping in the vaccinations. In fact, one of the biggest reasons why we're able to hit our record numbers as far as vaccinations are concerned is because of the help of because of the help of the private sector. Even with the vaccine express that we're doing, Pinky, we're basically dependent on private sector help. So there's a lot of good things happening. There's a lot of good things happening, but my take on this, Pinky, is everything should still be based on data available. For example, I was reading it's like an epidemiology analysis of the Delta variant. And I think I mentioned this earlier already, that in computing for the effective reproductive number, the efficacy of the vaccines being deployed is a huge factor. So with that data, that should guide government in, you know, in deciding what kind of vaccines we should start ordering now because of the data surrounding the Delta variant. Now it's many different things, and because COVID-19 is something new, the Delta variant is something new. Really, information comes in trickles. So it's again, it's really the agility of adapting to whatever information is given to us.
Yung pong sinasabi niyo po sa vaccines, because so far from also from the last update I've been reading, ang lumalabas po na mga analysis is coming from Pfizer, even Moderna. Wala pa ho kasi talagang published on Sinovac. Are you basically saying, Vice President, that we should procure more of these vaccines because there are studies on its efficacy on the Delta variant? Ganun ho ba yung inyong sinasabi?
Yung binabasa ko kasi, Pinky, kahapon, parang nagbigay siya, mas mathematical yung analysis eh. Parang nagbigay siya ng formula. Paano ba natin makukuha yung effective reproduction number? Parang sinasabi niya, Pinky, na yung effective reproduction number, yung basic reproduction number, ito yung sinasabi kong 6 to 9 pag sa Delta variant. Yung basic reproduction number, imumultiply mo yon. Imumultiply mo yon by, merong formulang binibigay, pero in essence, tinitingnan mo yung portion of your population that will be susceptible. That will be susceptible to getting the virus. And tinitingnan ko yung binibigay niyang formula. Yung pag-compute mo nung portion ng population na magiging susceptible, ang factor doon, proportion of people vaccinated saka vaccine efficacy. Yung vaccine efficacy, kasi kinocompute niya nga yung sa US, kinocompute niya, Pinky, yung sa US, na I think mga 50%, a little over 50% ang vaccinated. Parang it was a question of, should we give booster shots already or should we vaccinate more? And if you use that, it's data-driven. If you use that formula, pinapakita nung formula na vaccinating more people will be more effective than giving booster shots.
I see.
So para sa akin, dapat tinitingnan natin ito kasi yung booster shots are supposed to increase vaccine efficacy, di ba? Pero because of the formula given, mas mabuti na kung meron kang extra vaccine, bakunahan mo muna yung greater part of the population rather than start giving booster shots because of this formula. So ang point ko lang dito, Pinky, I don't go into the, alam mo yun, the specifics. Ang point ko lang, obligasyon din namin ng mga public officials na ina-update yung sarili natin, lalo na because hindi lang yung this are coming from experts, but we have to learn from the experiences also of other countries. We have to learn from the best practices or perhaps the pitfalls that other countries committed para matuto tayo, kasi hindi naman ito pwedeng trial and error eh. So kami, I'm sure government has been doing that also, lalo na yung mga agencies directly involved in COVID response operations na inaaral talaga yung mga lumalabas. Kasi pinaka-problema talaga nito, Pinky, it's not like flu na alam na natin, di ba? Alam na natin yung lahat na information that we need to know. Ito evolving talaga eh. So dapat yung policies natin has to adapt with the information that comes.
Vice President Leni Robredo, we need to take another short break. The Source will be right back. Watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Vice President Leni Robredo. I need to talk about politics, Vice President. I hope you don't mind. So, sinabi niyo na po bakit niyo nireject itong unification formula from Senator Ping Lacson. But during an interview, sinabi niya, he said, sana daw, you said, pinag-isipan mo daw, sana pag-usapan natin yan, sabi po niya, at magkokonsulta ka sana sa inyong mga supporter. Why was it an immediate rejection? Why did you not give yourself time to think about it?
kasi, Pinky, I felt so strongly about it. Kasi yung pinaka-proposal talaga, we all file. And pag nag-file kami, Pinky, magsasabong na yung aming mga supporters. Pag nag-file kami, yung mga supporters namin, aasa na. Mga tao tataya na sa amin. Aasa na sila na dahil nag-file kami, hanggang katapusan nito. Ang ayoko, Pinky, maging sitwasyon, yung nag-file kami, tumaya sa amin yung mga tao, in the middle of the game, bigla kami mag-withdraw. Sa akin, I didn't feel good about it. Pero yung usapan kasi namin, Pinky, hindi namin yung tinuldukan. In fact, yung usapan namin, to continue talking. Halimbawa, one of the things that we agreed on is pagdating ni Senator Manny Pacquiao, we will try to sit together and discuss. So ang paniniwala ko sa negotiations, Pinky, again, it's a continuing thing until makahanap ng common ground. Ganun naman yun, di ba? Ina-expect ko na hindi siya magiging madali. Kasi ang pinanggalingan namin iba-iba. Hindi naman kami magkakaibang partido. And expected ko na iba-iba yung pakiramdam namin about many things. Pero hindi gusto sabihin, now we don't agree on one, we can't agree on more, on other proposals anymore.
But I wanted to ask you, is there a possibility you'll change your mind on this unification formula, or your mind is set?
Hindi, sa akin, Pinky, ang paniniwala ko talaga, the 2022 elections is a very important elections. Meaning to say, because it's a very important elections, we should really give unity a chance because too much is at stake. Kailangan maging bukas tayo, makipagkaisa sa mga taong maaaring, gaya na sabi ko, iba ang galingan, pero ang gusto din pagbabago sa bayan. And you know, I have repeatedly said this in the past that I will exert all effort to reach out. Paniniwala ko, obligasyon namin sa taong bayan na subukang i-broaden ang base at maghanap ng common ground. Pero with that particular proposal, ayoko kasi, Pinky, na parang may panlilin lang sa supporters. Ayoko yung nag-file kami. Siyempre, pag nag-file kami, Pinky, meron na yung sinasabi ko kanina, tataya na yung mga tao. Pag tumaya na yung mga tao, sinamahan ka na sa laban. Sinamahan ka na sa laban na kung mag-withdraw ako middle of the game, ang pakiramdam ko, panlilin lang eh.
Okay.
Pero ako, I knew parang it was a bold proposal. I knew that Senator Ping was like me, also seeking more ways by which we can forge a unity of some sort. Siguro find a common ground. Hindi ako sang-ayon sa proposal na yun, pero para sa akin, Pinky, ang dami pang ibang pwedeng pag-usapan. Magkaroon din ako ng mga proposal na ayaw niya din. Pero dapat yung pag-uusap should continue until, alam mo yun, makahanap kayo ng common ground. And hindi lang naman kami yung mag-uusap. Hindi lang ako, hindi lang si Senator Ping, hindi lang si Senate President. Marami pang ibang mga kailangang should join us in the table na dapat continuing exercise.
Have you actually reached out to Senator Pacquiao?
Yes. I've exerted every effort to reach out to almost everyone already, Pinky. I haven't talked about it kasi hindi ko alam if they are comfortable na kinakwento ko na nag-usap kami. Pero I've always been very open that I am the one seeking, initiating discussions with almost everyone. Ang lumabas lang kasi, Pinky, yung kay Senator Gordon, because Senator Gordon talked about it. lumabas din yung kay Senator Ping because he talked about it. Pero yung all the others, gusto kong irespeto. Yung privacy na hindi wala kaming usapan, Pinko, na to talk about it. Pero I'd rather na hanggang nag-uusap pa lang.
I see.
Ito ko yung comfort level nila.
Pero nakausap niyo na ho ba? I guess I just want to ask, were you able to speak to Senator Pacquiao already?
Yes. I've spoken to him I think twice already.
Okay,
And
I'm sure.
Yung sa akin mas exploratory. Wala pa, pinag-uusapan pa lang namin yung mga pakiramdam namin about the elections, at ano ba yung stand namin about this. Mga ganun lang naman muna, Pinky, yung tinatanong ko. Wala pang pinag-uusapan kung sino suportahan.
Opo.
Tinitingnan ko lang muna, Pinky, would you be willing to sit down and talk further? Yung mga ganon. Yung mga ganon na mas early. Yes, the last time I talked to Senator Manny was, I think, the day before he left for the US. So yung usapan namin, sige, pagbalik mo, mag-usap ulit tayo.
I see. Yung pong very quickly lang, I hope you don't mind, VP, kasi if you want a unified opposition, hindi ho pwede talagang may Lacson, may Robredo, may Isko. I'm not sure no if you can isama po si Senator Pacquiao dyan, tapos meron din pong Senator Gordon. Kung magkahiwalay-hiwalay kayo, even let's say even with Senator Trillanes, sabi niya if magsama kayo ni Senator Lacson, di ho ba baka daw hindi kayo, he might, sabi niya, pasensya na po, I might withdraw my support together with the Magdalo. I guess my question is, how important is it that the seeming, those who are not part now of the Duterte administration, kailangan ho magsama-sama kayo para po matuloy itong sinasabing opposition, na malakas na opposition? Because if we are to trust the surveys, it's really Mayor Inday who is stopping it.
Ang paniniwala ko kasi, Pinky, na dapat hindi i-limit lang among us yung pag-uusap. Actually, even among our supporters, meron debate tungkol dyan. Yung iba talagang yung mas purists na tayo na mag-usap kasi tayo lang yung oposisyon, lahat sila hindi natin dapat sila kausap. Pero actually, I'm more, hindi ko alam kung pragmatic yung mas tamang term, pero para sa akin yung paniniwala ko, we should broaden the base. Totoong marami kaming differences, pero the reason why the exploratory talks are happening is because we want to see if we would have common grounds that we could agree on. Early days ito, gusto sabihin hindi dahil kinausap ko na tapos na yung usapan. Kasi lahat naman na nakausap ko, Pinky, ang resolution, mag-usap ulit. Lahat naman na nakausap ko, willing to... So sa akin,
open pa.
Worth...
Yeah. Vice President, I hope you don't mind. I have 1 minute left. Where are you in terms of your decision to run for President? Nasa na ho kayo ngayon?
Yung decision making ko, Pinky, involves a lot of many factors. It's not just the numbers. Kasi yun yung paniniwala ng iba na what's keeping me from deciding is just the numbers. Hindi yun. Yung iba naman, Pinky, yung paniniwala, parang personal convenience ko. Sabi ko, I'm way past that. So hindi na yung tanong, gusto mo bang magpangulo o hindi? Kasi para sa akin, mas sense of duty na siya. Pero having said that, I know that the 2022 elections is a very important elections. It would determine what will happen to the country in the next 6 years after the elections. And sa akin, Pinky, I've repeatedly said this, na I don't think that the country can last another 6 years, with this kind of governance, especially because we're in the middle of the pandemic. And we saw how governance plays a very crucial role in crisis situations. So sa akin ang paniniwala ko, obligasyon ko. Obligasyon ko maghanap ng maraming mga marami mga options, hindi para sa akin, pero para ano ba yung kabubuti ng bansa. And
All
pag
right.
sinabi natin na kabubuti ng bansa, again, it's many different things.
I hope we have more time, but we are already over time. Vice President Leni Robredo, ma'am, maraming salamat po sa inyong oras.
Thank you, Pinky.
Thank you. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.